Hi everyone, this is Yilyas, and I'm excited to finally be sharing my project with you all. My project is a quality improvement project to aid in the prevention of hospital-acquired pressure injuries, or Hapi, on the 5th floor at Kaiser Permanente Sacramento Medical Center. I coined it the Hapi Clock, a clock to be posted in every patient's room with a Braden score of 18 or less. With this clock, nursing and PCT staff will be able to know when to reposition these patients and when they were last repositioned. Hospital-acquired pressure injuries are one of the top adverse events reported in hospitals, a common cause for medical complications including infection, prolonged hospitalization, and permanent disabilities. This results in pain, decreased quality of life, and a heavy illness burden on the individual. Briefly going over the agenda, I will go over an introduction, primary goals of the project. I'll introduce you all to the team, the Hapi Clock itself, the timeline of the project, feedback received on the project, and a summary of my findings and final thoughts. And lastly, my reference page. My project is a quality improvement project to aid in the prevention of hospital-acquired pressure injuries, otherwise known as Hapi, on the 5th floor at Kaiser Permanente Sacramento Medical Center. Pressure injuries can be defined as injuries and/or underlying tissue damage localized over a bony prominence resulting from pressure force and/or pressure combined with shear. This is from Gaspar et al.'s 2018 study. Already set in place at this facility is a Hapi bundle for patients with Braden scores of 18 or less, which includes, but is not limited to, repositioning every 2 hours, a 2-nurse skin assessment that requires documentation per shift, and updated skin photos every Wednesday, known as Picture Day. The idea for this project is a laminated clock for patients with pressure injuries or at risk for Hapi with a Braden score of less than 18. This clock will serve as a reminder for staff members to reposition these patients. Clocks will be posted on care boards in the rooms of patients who have a Braden score of 18 or less and unable to mobilize, and will include timestamps in which registered nurses and patient care technicians, or CNAs, can initial after repositioning the patient. This will make for a great visual tool for staff members to utilize. Resources for this project are quite minimal. The implementation of the poster board is cost-effective. Training and education on the poster board can be presented during pre-shift huddle. To create 50 posters will cost no more than $30 at a local FedEx, Kinko, or Staples and can be laminated on-site. Posters are to be laminated so they can be marked with dry erase markers and reused after being properly sanitized, saving the unit money versus having single-use posters. Nurses and PCTs will be asked for anonymous feedback via post-it notes in the staff break room. This data will be used to assess the need for the project idea and/or if they felt it was helpful towards patient care. Based on staff feedback, we will decide whether the project shall become a permanent addition to the unit's Hapi bundle. Overall, the implementation of the project is cost-effective and feedback should be easily obtained as the surveying method is open to all staff and anonymous. I decided on this project to aid in prevention of miscommunication among staff members regarding repositioning. The Hapi Clock will leave no room for uncertainty on whether the patient was repositioned or not. In addition to this, it will serve as a visual reminder to staff who may forget to reposition patients. Goal for this initiative is to provide timely repositioning of patients, to maintain accountability amongst RNs and staff, and to reduce miscommunication between staff members in regards to repositioning of patients during an 8-hour RN shift. Per a study by Gaspar et al. In 2018, care bundles in a clinical practice context seem to improve patient outcomes in terms of pressure injury incidents with a small set of interventions performed collectively and reliably. This is why I sought to believe the Hapi Clock would be an excellent addition to the unit's Hapi bundle, as it promoted all of these goals and would effectively reduce the amount of pressure injuries on the unit. I wanted to introduce the 5th floor team. For this project, I reached out to both my direct supervisor and assistant nurse manager, Joy Monet, as well as Nanette Sigwa, who is our department manager. They both offered their help and resources and essentially gave me their blessing for the project. Estela Santos is a colleague of mine who I work with on 5 West, who is a staff nurse 4 and is the lead of the quality committee on our unit. Throughout his time on the 5th floor, he has implemented many quality initiative projects and has climbed the clinical ladder in doing so. I figured he was the perfect person to guide and advise me throughout the project. Ace provided lots of guidance and even encouraged me to join the quality committee so that I could climb the clinical ladder as he and many of my colleagues did. He is actually the one who revised my project from a poster board with timestamps to the Hapi clock idea. I must say, working so closely with my supervisors and seniors of my unit was an invaluable experience. Moving on to the Hapi clock itself. Firstly, I wanted to share on this slide the earlier draft of this project in comparison to the final draft. The first draft of this project was originally a poster board as seen on the slide. This poster was launched mid-March, but was shortly withdrawn and revised. After implementing the poster board to the unit, what Ace pointed out to me was that the poster was too cluttered and busy. It was simply too difficult to decipher its use upon first glance. The poster was also large and bulky in size. We noticed it took up too much room on the patient's care board. The Hapi clock was reintroduced in late March and brought to the staff's attention during pre-shift huddles. The concept remained the same. Nursing and PCTs were to mark the next time of repositioning on the clock and initial when the patient was last repositioned. However, this time, the clock was simpler in design, visually striking, and easy to understand. The Hapi clock was also smaller, only a half sheet of laminated paper, taking up far less room on the patient's care board. Overall, I was much happier with this design in comparison to the previous poster board. Professor Kim suggested I use a 24-hour clock versus a 12-hour clock, which made sense, so I made that adjustment as well. The Hapi clock is also presented on the slide. I thought it was important to share the timeline of this project with you all, and I like to think that this slide makes for a great visual of the behind the scenes of the project. So starting in January, I began with my project topic selection and the drafting of my project statement. I knew I wanted the project to be about hospital-acquired pressure injuries and how we could prevent them. By February, I was able to present my finalized proposal to Professor Kim, as well as my managers Joy and Nanette on the 5th floor of Sacramento Medical Center. By mid-March, I was able to implement the first draft of my Hapi clock, and by late March, the final draft was reintroduced and implemented onto the units. By mid-April, I gathered feedback from participating staff members to present my findings to the class, and by May, PowerPoint slides and my abstract will be submitted to Professor Kim. Feedback for this project was simply gathered through a trifold poster board with sticky notes available in the staff break room, which was again communicated during pre-shift huddles. The questions on the poster board revolve the primary goals of the project, which was timely repositioning, accountability among staff, and preventing miscommunication among staff. Based on these results, I created this chart. Answers to these questions were determined as yes, no, or other, which is what I considered a mixed answer. Yes, but. No, but. These were all considered to be other. Of the 32 participants that were willing to provide feedback, you can see that the overwhelming consensus is that no, this project was not helpful to the unit. The overwhelming response that I received across the board was that it was redundant. This unit has many Hapi projects implemented on the unit, alongside many other, including fall risk projects and delirium projects that we have on the unit. And so that was the most common answer, was that, the clock is great, however, it doesn't provide anything new or doesn't revolutionize our Hapi bundle in conjunction to all the other projects that we have in preventing hospital-acquired pressure injuries. In conclusion, feedback gathered from staff participants determined that the Hapi clock was unhelpful. The overwhelming complaint was that the clock was redundant in conjunction to the many Hapi projects already implemented on this unit. Chu et al.'s 2018 study found that frequency of repositioning did not make a difference alone in the prevention of hospital-acquired pressure injuries. Rather, it is a combination of multiple skin interventions, such as mattress type, pressure relief devices, protection of bony prominences, maintaining adequate nutrition and moisture, etc., that makes a difference in prevention. In combination, it is proven that uninterrupted pressure for long periods of time was a major source for pressure injuries. Therefore, regular repositioning to redistribute pressure from specific regions of the body is crucial to maintain tissue vitality. This isn't to say that the project idea can't serve a purpose, just that the fifth floor seems to have a well-established Hapi bundle that works well for the unit. This is still a great project idea and can be re-implemented here or elsewhere with some adjustments and revision. In the future, I believe it can be reintroduced and used to climb the clinical ladder on my unit for my Staff 3 or Staff 4 title. Kaiser is big on having floor nurses as a part of the quality improvement on units, and in fact are encouraged to climb the clinical ladder in this manner. I can also see this project being used as a post-acute or skilled nursing facility where patients are primarily immobile and pressure injuries are more common. Overall, this was a great experience that required lots of team building and rapport building with my fellow coworkers and supervisors on my unit. I can say I learned a lot from this invaluable experience. I wanted to thank you all for your time, and I look forward to watching everyone's presentations. The next slide includes all references used throughout the conception of this project. Thank you again. References include Gaspar et al.'s 2019 Systematic Review, Chu et al.'s 2018 Scoping Review, Moore and Patton's 2019 Systematic Review, and Teo et al.'s 2019 Case Study.